Excuse us as we organize our appropriate social distancing plan this morning, so thank you very much. Welcome to our Friday, April 10th briefing. And first, I wanted to let you know who will be here with us today. We will hear first from our County Executive, Armin Budish, to provide his overview of current relevant information. I'll then provide an overview, followed by Dr. Gullett, her usual Friday data report. And we will also hear from Ramona Brazil, who is our Deputy Director of Prevention and Wellness. So that'll be the order of how we'll be here today to present. So with that, I'd like to give the podium to County Executive Armin Budish.
Good morning. I want to again thank Terry Allen and Dr. Heidi Gullett for doing so much to keep us safe in this community. It means so much to everyone. And I want to thank all of you, the media that's here, to help us get the important information out to the public. It's critical people understand what's happening. Today I want to focus on our kids. As you know, schools are out, possibly through the summer. Our kids are not on vacation, though. Schools are trying to continue educating our children and doing it online. Kids can continue their education over the internet. And that works if the family has internet access and a computer. But how can they keep up with their education if they don't have computer or internet access? Now, I would guess that everyone in this room can get onto the internet at home anytime they want. But more than 25% of the families in Cuyahoga County do not have a computer or internet access. How can their children do their online homework? We've recognized this problem of lack of connectivity for years. A couple of years ago, we created the Connect the Unconnected program. We worked with Huntington Bank and the Cleveland Foundation, the county libraries, the Cleveland libraries, and we purchased 250 hotspots, which they've been circulating on a borrowing basis. And these hotspots have been continuously in use. They've really made a difference. But that doesn't solve the problem for our children. There are not enough hotspots. And with the libraries now closed, there's no way to continue to circulate them. So we're taking more action to help our children get connected. The county's donating 300 hotspots to the Cleveland Metropolitan School District, CMSD. The hotspots were graciously provided by the Board of Elections and were scheduled to be used for the March in-person primary. Obviously, that didn't happen. And these hotspots will be replaced for the November election. Our team worked with AT&T to identify a plan to provide Wi-Fi access for free for about 2 months for each of the hotspots. That should take the children through the end of the school year. CMSD will distribute the hotspots to students. We're also working with Secure Recycling to provide Chromebooks with most, if not all, of the hotspots for students to use through the end of the school year. The county has put a call out to local businesses for computers, computer equipment, such as keyboards, mice, and monitors, and more hotspots that can be donated to PCs for People. PCs for People can take working and non-working equipment. PCs for People provide free or low-cost devices to individuals based on income and low-cost internet plans. They can safely pick up and refurbish computers and hotspots to go out to users. This includes computer cleaning and data destruction. PCs for People is NAID AAA certified for data destruction, allowing businesses to feel confident that their data will be secure throughout the destruction process. Pickup for most equipment is free to businesses. All equipment is needed right now, and it's welcome, and can be turned around quickly to go to families in our community. The most pressing needs right now not only are for hotspots, but for keyboards, mice, and monitors. While providing 300 hotspots is very helpful, it's not sufficient. The county's also creating maps for each of the CMSD meal pickup locations. And you see a map over here. This is what it'll look like. It shows people where they can go for free internet access. These handouts will be provided to CMSD, which will go out during their meal pickups. And again, handouts include a reminder on social distancing and using public Wi-Fi safely. The county's adding a section on digital inclusion resources on the COVID-19 website that we have. It'll list the various low-cost plan options that are available, places to get low-cost devices, and where to get help. We'll do a press release with all the information, and we'll ask you, the media, to help get the information out to the public. I want to introduce Curtis Timmons, who's over here, and Catherine Tkachek. Curtis is with CMSD, and Catherine is with the county. She's the one that helped put this whole program together, and if you have questions, they'll be here to help answer them. During this coronavirus crisis, we want to give all of our kids, even those who don't have a computer and can't afford internet access, we want to give them all an equal chance to continue learning while this is going on. Thank you.
Thank you, Executive Budish. I just want to take a moment again to thank Armin for his partnership. From the beginning of this response, the county administration has been there to support the work of public health and the needs of the community every step of the way, through the coordination at the Emergency Operations Center, around distribution of key personal protective equipment, around identifying social needs for a whole range of at-risk populations. The county executive and his team have been incredibly supportive of this response, and I think this is the way government is supposed to work, and people expect government to work, so I wanted to thank you for that. So, along those lines, we're happy to hear about the reports, the multiple reports in Ohio of innovations to try and address needs. We're aware that the Ohio Manufacturing Alliance is working with state government to develop a plan to manufacture personal protective equipment here in Ohio. We've heard stories already also about Patel sterilizing personal protective equipment. So these innovations are essential, even in the day-to-day response, that work is happening to retool and produce PPE like face shields that can be sterilized and reused. They went from prototype to production in 2 weeks, and up to 1 million will be produced statewide for distribution by the Ohio Department of Health. We're fortunate for this innovative spirit of our fellow Ohioans to meet the pressing needs in this pandemic response. As you know, we talked earlier this week about enforcement as it relates to the state order regarding business operations and essential services. We continue to address complaints as they come in by the hundreds about non-essential businesses, social distancing in workplaces, and public gatherings. We're working with the Ohio Department of Health and our colleagues in other counties as we make fair and protective interpretations of the state order. Please recall that the spirit of the order is not to be punitive. The spirit is to help to save lives and create a safe environment. Along with law enforcement, we want to encourage compliance and voluntary shutdown so that less people are out in public every day. We recognize the major disruptions and sweeping economic concerns related to these decisions that have caused hardship for many in this community, hardship across the state of Ohio. None of this has been easy, and we have to maintain our resolve to get through this together. Current data trends are indicating that all the sacrifice that we've made, all of it, has made a difference in preventing illness and saving lives in our community, and we're inspired by the countless acts of kindness and selfless acts that occur every day in the face of these challenges. We must all do our part during these unprecedented times, and we can't let up now. We can't let up now, particularly as the weather begins to change. All of us are drawn out, and that's fine. I think doing that safely and at a proper physical distance, it needs to be the order of the day. And so we also don't want people to gather in groups, large groups. We know that people have been politely asked to dismiss, and we think that's the proper way to approach this so that we don't unknowingly and unintentionally start new chains of transmission across the state, here in our community, that could perpetuate this to a larger degree and result in unnecessary illness and fatalities. This is what this is about. This is the Ohio plan. Get some exercise. I know I could use more myself. And just be careful to maintain that social distance. We know with Passover and Easter currently at the forefront, in our faith-based calendars, I'd like to offer some words of wisdom this morning that Governor DeWine shared. He delivered a brief reminder about religious events and mass gatherings recently. And he said that anybody who goes into a big group of people is making a very, very serious mistake. They're endangering themselves, they're endangering their family, and they're endangering total strangers. Anyone who brings people together in close proximity to each other is making a huge mistake. And we know this because the data tells us, and we've heard stories about spread in communities where people unknowingly were a trigger for cases and transmission that can spread from points that people cannot even begin to understand. People coming together unnecessarily in workplaces or gathered together in events and go back to their various communities and their families and then spread potentially additional chains of transmission that perpetuate the outbreak not only in their neighborhoods and in their communities, but potentially across Ohio. So we've heard of many congregations finding alternative ways to practice their faith. These include video streaming and radio broadcasts, among others, and we think these are great examples. And we urge you to be safe and protect yourself and others this weekend. We've made way too much progress to stop now, and wish everyone a peaceful weekend as you share the spirit of the moment. We know that current public health guidance dictates that we continue to maintain that physical distance, even as we also know that family are always with us in our hearts. Please know that all of you are making a big difference. You get to carry that with you for the rest of your lives, and this is response, and this point in time is something that we'll all remember. And the way that we handle it, the way that we interact together, the way that we follow the science and the data and the guidance will reflect the story of Ohio and of Cuyahoga County. And we intend to continue to follow the Ohio plan to protect our citizens. Transitioning, we've indicated our intent to share some of the initial analysis of racial demographic data related to COVID-19. You'll hear from Dr. Gullett and our Deputy Director of Prevention and Wellness, Ramona Brazil, to share some data, history, and context. And the data will relate the unnatural causes of disproportionate suffering, disease, and death faced by people of color in our community. It's important to remember that these disparities and inequities did not emerge with COVID-19. They relate back to our original sin of racial injustice in this community. And so with that, I'd like to give Dr. Gullett the podium.
Good morning. Thank you all for being here. Thanks again to our media partners who have been steadfast in their continued coverage of the COVID-19 crisis in our community, and we continue to thank you and be very grateful for your work in this area. I'd also like today to thank the leaders in our faith communities. We have quite a few faiths represented here in the greater Cleveland area, and we're very grateful for the partnership among all of the leaders in those faith communities. We've had tremendous communication, outreach from some faith leaders and others we've reached out to around how to create new ways of worshiping across lots of different faiths in this really unprecedented time of learning how to do things without being physically together. And I've been really encouraged by the level of creativity and the level of thoughtfulness among so many faith leaders, especially as we enter a particular time in our calendar where several faiths have holidays this week. So we would really like to thank you for your creativity and your commitment to the public health recommendations. And we would ask that people please adhere to them and partake in the new and creative ways that your faith leaders are offering worship. I'd also like to thank our county executive and your team, as well as our colleagues from CMSD, who have really been working hard to ensure an equity-based approach to the digital divide, which has been an ongoing issue in our community and so many others. We need to ensure that as we have public health efforts which really change the way our children learn, change the way we interact with one another, that no one is left behind because they don't have access to internet or electronic devices, which are absolutely critical to the new normal that we've now found ourselves in. So we thank you for your leadership in that. That is critically important to us here in the public health side, as well as I know all of our educational leaders across the community. I'm going to pause for a moment and allow Heather to position over to the slides and allow our camera people to make sure that they're positioned on the slides before I begin to talk about our data today. Okay. I'm waiting for the thumbs up from everyone. Or a nod. Okay, I think we're good. All right. So I'm going to present initially our CCBH, or Cuyahoga County Board of Health jurisdiction data, as I normally do. And again, these slides will be posted after today's press conference on our website, along with all of our other prior slides and recordings of each press conference. I'm also today going to talk about some context for why presenting racial and ethnicity data is really important, not just in COVID-19, but with all discussions of health and equity in our community. So to begin with our own jurisdiction data, our total lab confirmed cases are 746. The age range of those cases remains 1 week to 101 years of age. The date of illness onset is February 29th to April 6th. And we have 20 deaths in the CCBH jurisdiction that are COVID-19 related. The age range of those deaths is 55 to 93, and the dates of death are March 20th to April 7th. We have 8 females and 12 males included in that data, in those data. And again, I want to remind all of our viewers and the public that we continue to really want to support these families who are affected by illness and affected by loss of loved ones from these deaths. These are not numbers, these are our invaluable community members, every single one of them, and we need to support them and also respect their privacy. The number of isolation orders this morning from our jurisdiction is at 737. The number of quarantine orders is at 1,427. And we feel that it's important to celebrate that we've now cleared or discontinued isolation for 143 people who've been infected with this condition. These, again, numbers change literally by the minute and hour, so you will continue to see that these change very frequently. We're reporting them out on Friday, but by the time I've said these numbers, they're probably higher now. So for the next few minutes, I would like to talk about why it's important to present race and ethnicity data, not just during COVID-19 or the coronavirus crisis, but every single time we talk about health in our community. Health is impacted by so many things. It's impacted by the choices each of us make around what we eat, the exercise we do, the water that we drink. But it's also related to the context or the environment in which we live and the opportunities that we have around housing, jobs, education, and many other things. In our work here at the Cuyahoga County Board of Health, in partnership with many others across our community, we've spent more than the past decade trying to understand how different opportunities emerge, particularly for communities and individuals of color here in Greater Cleveland. We know that communities of color in our community and others across the nation have different opportunities, and those opportunities relate back to systems and structures and bias that have existed in our country for many, many, many years. So today we're going to give you just a little bit of context about this. We certainly cannot do it justice in the few minutes we have with you this morning, but we're going to try to give you as much context as we can about why this is so important, and then we will continue to provide added context and details as the weeks go on. This report that you see here dates back a few years to when we originally started working on this back in 2009. This report was released a few years later. But what it highlights, and I would encourage you to go to our website, which is on the next few slides, hipcuyahoga.org or ccbh.net, and read this, because it talks about the history of banking practices and redlining in our community, specifically of Cuyahoga County, and how those practices have led to unequal opportunity around housing and around where people live geographically. And that links to contemporary injustices around differences in life expectancy and other health outcomes that have occurred in our community long before COVID-19 arrived, but also set up members of our community and communities of color here for different outcomes for an emerging infectious disease like COVID-19 and many other things that affect people in our community, such as lead and infant mortality. So this history is critically important, and this history has to be understood. This is a history that is about structural racism, and we have to understand this in order to understand why we need to present race and ethnicity data, and why we have to be very careful about our approach, ensuring that no one is left behind during COVID-19 or coronavirus, but furthermore, during any particular time in our community. Once we're past this, this is all very important for every particular health issue in our community. So after 2009, initially in the Place Matters movement, which was a collaboration of many different partners across the community, a large cross-sector group called the Health Improvement Partnership Cuyahoga, or HIP Cuyahoga, emerged as a learning community focused on racial equity in order to understand how we could come together across sectors in Greater Cleveland to ensure that everyone has an opportunity to thrive here. Everyone has an opportunity to reach their full health potential. And that includes addressing issues around the economy and jobs, housing, food, exercise opportunities, and many others. And in 2015, we released our first community health improvement plan. That was among, at the time, our 3 local health departments, along with many other partners. And at that time, we called out a priority of eliminating structural racism as a critical part of our community's efforts to ensure everyone has an opportunity to reach their full potential, to mean equity is achieved here in our community. That work has continued in many different ways over the past few years, and I would invite you to our website, hipcuyahoga.org, to learn about all of the different ways in which that has evolved. The leadership of HIP Cuyahoga has included many different organizations and community partners, community residents representing lots of different neighborhoods across our region, as well as our hospital systems, social service agencies, policy think tanks, and others. That work then led to our first collaborative or combined community health needs assessment among our hospitals and our local health departments, which was released last fall. You may have seen coverage of this, but I would encourage you to revisit it. Look again at our priorities, because they are increasingly important in the midst of COVID-19, which we know has the potential to disproportionately affect communities of color and others that don't have the same opportunity based on the history of structural racism in our community. You'll see a number of logos on this slide which come directly out of our community health assessment report, And these are groups that are all working together to create a shared agenda around racial equity and to ensure that people have an opportunity to thrive and that we can tackle something together much more effectively than we ever could as individual organizations. And that is so important today, even as it was last fall before COVID-19 hit our community. It's even more important now, and it will be continued importance after COVID-19 leaves our community. So the last bit of context I want to give you is an infographic that comes out of our most recent report. And at the center of this is that limited opportunities, which were created by systems, structures, and policies, have combined with poor health, which also are related to systems and structures, and led to shorter lives for our community, particularly communities of color here in Greater Cleveland. And those issues have the potential to further be realized during COVID-19 and coronavirus. So we want you to understand this work happened before and it continues now, but we also want you to understand the context about why we feel so strongly about presenting race and ethnicity data. I also want to say that the data you see and the race and ethnicity data you're going to see today only represent those who have been tested. And I will again say that we are limited in our testing, which has really big implications, profound implications for understanding the true prevalence or the true amount of infection in our community. So if there are groups in our community who haven't been able to access testing, you're not going to see them reflected in any of the data I present today, or that our teams are working to analyze, which is why we need to continue to be determined about increasing the amount of testing for everyone in our community, not just those who are hospital employees, healthcare employees, or those who are hospitalized. This is part of the equity-based approach we have to take as a community to ensure that no one is affected by this and not getting what they need. So I am just including this as reference again. This is the classic Flatten the Curve illustration, and you're going to see our information here next. So this is the updated Cuyahoga County Epi Curve. Again, what you're seeing here is what happens 1 to 2 weeks before you see the data presented to us. Okay? You can't see the data presented until people become symptomatic and are tested. So first, this only represents the people who are tested. Secondly, it only represents what kind of exposures happened 1 to 2 weeks before they were tested, because that's when they became symptomatic. So that means this weekend, if you are celebrating a holiday, please celebrate a holiday virtually. Please celebrate a holiday with your household, not with your family and friends who live across the street or in the next town over in person. This is really important because if you begin to go and celebrate in person, we will see this go up 1 to 2 weeks from now because we will have more infections from new lines of transmission that occurred over the holidays. This also shows that we're increasing those recovered cases. Remember, I reported 143 in our jurisdiction alone today, and this is for the combined jurisdictions of Cleveland and Cuyahoga County. So this is great news, but we can't let up. We want to go until we see all those green bars up, and all of the red turn into green recovered cases, and very few are deaths. This is the updated map for this week. You will note it has continued to become darker green, which means that we have increasing number of cases across many zip codes. And we had reported last week that we expected this continue to get darker across multiple areas, and that is what we are seeing. The takeaway from this is that the infection is everywhere. And again, remember, what you're seeing here is the address that people who have tested positive report as to where they live. This is not the location where they were exposed to the infection. We don't know in many cases because of the degree of community spread. It could have been at the store when they were out getting food. It could have been at work. It could have been anywhere where they encountered someone else. But this reports where they live. The positive aggregate estimate is an understanding of how many tests were done overall and how many are positive. It's been pretty stable for us here locally over the past few weeks, and I give a range because we didn't get the same data from each of the different groups testing. So I could only give you a range. I couldn't combine the data specifically. But it's 11 to 13% of the tests done are positive. And the reason that that remains where it is because we're still mostly testing very sick people in the hospital or healthcare employees, or those who had specific exposures, first responders, et cetera. So we expect a lot of those to be positive. If we were testing the general community, including people who didn't have symptoms, to see if they might have the infection, it would probably be lower. So this is a reflection of who we are testing. And again, it's remained very similar. The number of cases in our community, as you saw earlier, is over 1,000 combined jurisdictions. Those are lab-confirmed cases. 33% of those cases have at some point during their illness needed a hospitalization. That means being admitted to the hospital, not an emergency department or urgent care visit. 13% of those cases have required intensive care unit admission, meaning that they needed a very high level of care to manage the symptoms that they were having. And 33% of our community this week, and that's overall since COVID-19 epidemic started, 33% of the cases are healthcare employees. Today I'm also presenting you a breakdown of age data rather than just the range. I thought that our team, all of our epidemiologists, we all thought this would be useful to you. And again, these will be posted. But you can see the breakdown of age. And what I want to remind folks is that this virus affects people of all ages. So you are susceptible. Every single one of us is susceptible to this infection. And you'll see our highest actual number of cases is among people 20 to 44. So please know that. But also know that those who are older, we see a lot of the deaths occurring in our community in older age folks. So just recognize that as you think twice before going to visit your relatives this weekend. Please don't visit them over the phone or over FaceTime or over Skype. This represents the race data that we have available to us currently for the county, including the City of Cleveland and Cuyahoga County jurisdictions. We have 10% of the cases, so 1,021 cases represented here. 10% of those we did not have race data available, but we are working very hard to ensure that we have that for every case as much as we can. We will continue to try to get that as we move along. We've worked really hard to get it as we move along, but in some cases we haven't been able to contact people or confirm the race. 39% of the cases so far have been among folks who identify as Black. And in our county demographics, about 30% of our population identifies as Black. 44% of these cases, folks identified themselves as white. 7% as other races. So you can see here, we really want to present as much as we can around race, and you heard me talk earlier about why. Additionally, I am not presenting ethnicity data today, and that's because the data are highly incomplete right now. We are working very hard to ensure that we get much more complete data around ethnicity to present to you. But even the CDC director last night talked a lot about how challenging it is to present data that are not complete. It does not tell an accurate picture if we present data that are incomplete. So that is why you're not seeing me present ethnicity data, but I assure you we are determined to be able to provide that as soon as it is complete, or complete enough to give you an accurate picture. I also included hospital utilization data, and I will begin to trend this as much as I can for as long as I have accurate data. The medical surgical unit percent utilization, meaning the amount of beds we're using compared with the amount that are available, is actually no change. It's a 62% across our county. This is all systems, county level. Our pediatric utilization is at 37%, which is up about 6% from what I shared with you last week. Our critical care adult beds are at 68% utilization, which is decreased about 1%. And our ventilator utilization is at 35% across the county. That's a decrease of 20%. And this is about where we were 2 weeks ago when I gave you utilization data on ventilators. And then we went up to 55% last week, and we're back to 35% here. So this is just to give you a general sense of how close to that dotted line on the curve we are, how close are we getting to surge, making sure that we have all the resources we need in this community to care not just for our own residents, but for all those people from Ohio and surrounding areas that come to our county for medical care. So I am now going to transition over for you to hear from my colleague Ramona Brazil, who is a remarkable colleague. I'm going to give a minute for Heather to move over. So Ramona, as you heard earlier from Terry, is Deputy Director of Prevention and Wellness here. And Ramona, Terry, and I, as we settle into the new normal for the long haul here around COVID-19 response, are working together as incident commander leads and as the strategic direction among our team. There are just countless people working on this response, but the three of us are working together in that area. So you're going to continue to hear from the three of us on different lenses about this response. We also believe that this response shouldn't be dependent on any one individual. So we are working to ensure capacity on all areas of this response so that we always have the ability to lead this response on behalf of the Board of Health at the county, and regardless of what would happen for any one person. So you're going to see more of Ramona, but I'm really happy for you all to hear from her today.
Good morning. Like I said, my name is Ramona Brazil. I'm a Deputy Director of our Prevention and Wellness Service area. I've also been a registered nurse for almost 20 years now. So as Dr. Gullett spoke earlier and showing our data is very important to the Board of Health. It's one of the things that I think we do a lot of things well. Data is definitely one of the things that we think is pretty important to us, and that we dive in deep to show the impact of what is going on in our community in a variety of ways. So for many years, we've looked at racial data, gender, income, education, as well as many other different topics, such as access to care, food deserts, those types of things. So we are going to address COVID-19 the same way. We're going to do the same deep data dives as we can with COVID-19. So we feel that, in order to provide accurate data to the community, we have to have as complete of data sets as possible to really show what's going on in our communities. And our data analysts have been working. They were here late till last night working on the data that you saw today to be able to share that. Like Dr. Gullett said, I don't know how many more times we can say, testing is hampering our ability to show what a clear picture is of the spread of COVID-19 in our community. We know that people who need to be tested do not have access to testing. That includes people who are sick. That includes people who have been sick, who could be tested to see if they're not sick anymore. And it also includes people who don't have access to testing. So we're limited on supplies, as well as some of the methods that we can use to safely test people can actually create barriers. So you can't go to a drive-in testing site if you don't have a car. So, and if those locations aren't accessible to people, that also puts up a barrier to some people to be able to access testing. So this data that we see so far is really more representative of who's had access to testing versus necessarily what is the actual prevalence, like Dr. Gullett stated. So we don't like to present data without understanding the story behind data. Data is only one part of the picture. It's just the numbers, but people really are what are behind the numbers. So some of the conversations that have been going on nationally, as we see some really large disparities or differences in health outcomes in communities of color in other major metropolitan areas, have really focused on differences in chronic health conditions. So as a nurse, if I'm going to call someone, we're going to talk about those chronic health conditions. We're going to talk about asthma, lung disease, heart disease. We want to know people's history because we know that that does place them at higher risk of having complications from COVID-19. And we really stress, and I don't know how many more times I can stress, that we want people to really pay attention during that second week of illness because that's when we see a lot of people get really sick. And so we're going to focus on that. But as at the community level, we have to look a little deeper at what is causing those differences in those health outcomes. So I saw a post this morning from Bernice King that was a Desmond Tutu quote. And we've used this example when we talk about equity before. But there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. So we need to understand what are causing the differences in the health outcomes. And Dr. Gullett discussed some of the inequities that are the root causes of health disparities. So we've looked at that type of data for many years now. So we've looked, and many of you have seen that kind of data through the maps we presented, looking at life expectancy, infant mortality, asthma, lead, and cardiovascular disease, to name a few. But we know that past policy and system decisions, as well as things that still occur today, have shaped our communities, and they have created a familiar pattern of poor health outcomes in our most under-resourced communities, including many African-American communities in Cuyahoga County. So we have worked to address many of those underlying conditions, such as access to healthy and affordable food, access to health care, and safe places to exercise, like playgrounds and parks in our communities. I think one thing that is important to convey is that everyone is affected by COVID-19. Like Dr. Gullett said, it is throughout our community. But there are some people that are going to be impacted more. So our under-resourced communities are often already living on the edge. And emergencies like COVID-19 in many ways push them into crisis. And for some families, it's not going to be a temporary crisis. It'll be one that will be years of impact felt. So we also need to understand that some of the underlying issues that contribute to this include things like access to sick leave. So one of our messages, stay home. We want you to stay home. But for some people, staying home is not possible. They have to go to work. And when we've called people and we've talked to them, there have been people literally who need to stay home who are afraid to lose their job. And so we understand that that is a major barrier to us trying to achieve this public health goal, but people also needing to maintain their very basic needs and for their communities and their families. We also have issues such as adequate housing. We've seen that when we talk about preventing homelessness in our community. Access to health care. We've talked about the need for free testing for COVID-19 and also the concerns around treatment. But all of these barriers make it more difficult for people to be healthy and to stay safe. So we have to make sure that our safety net services are available to the most under-resourced communities. Barriers can be presented, even those that are unintentional, that can make these times even harder for many families. So hearing today, and I am a proud CMSD graduate. Internet was not a thing when I was in high school, but I'm glad that the children will have access to it. But digital divide is something that we have noted, previously as lead case manager, and, kids doing homework on cell phones because they don't have computers, or going to the libraries because they don't have internet at home. So to hear this is very encouraging for our kids. Also, considering how our resources are set up. So again, it's being done so it's COVID safe, but we also have to make sure that it's accessible to everyone. So some of like the food pickups and basic needs distributions that require a car are going to immediately create a barrier to families who do not have access to a car. And so as CCBH, we've worked for many years to address inequities. And we'll continue to work with our community partners to actively engage the community, to communicate. We also have to challenge some myths that we know exist. We have to continue to build trust, and we also have to look for, and creatively, and we have been doing that behind the scenes, at resources for families and also the barriers that prevent them from being able to access them. So finally, since Terry gave me a platform, thank you, Terry. I just want to say, we are asked many times, when will this be over? Many times. And the answer is we don't know for sure. We think we're doing pretty good. We have to keep at it. We can't let go. But one day, COVID-19 will no longer be a public health emergency. But when that happens, we have an opportunity to not just return to who we were before, but to carry the lessons and the gratitude that this situation has brought to our attention. So many of the things that we have done as a community, we can continue to do after COVID is over. There's been many advocates who've been screaming for years in community organizations about a lot of these issues. And we've seen our community rally. We've seen that we can be concerned about children who are hungry if they're not in school. We can make sure that people can have health care even if they don't have insurance. We can work on bail reform. And we can continue to prevent and address homelessness. And finally, we can continue to appreciate the workers we realize we rely on for our everyday lives. So, with that.
Thank you very much, Ramona. I'd like to thank Ramona for her leadership, her constant smile in the face of adversity, her grace. And I also reminds me, as we look behind us here with the cameras, you'll see 100 years of public health history, bracketed by 1919 Spanish flu pandemic, and here on the other end, COVID-19. So it's interesting context in which we stand before you, and public health has been there all the way through, often invisible and silent in between in those moments. We want people to recognize that about 3 cents out of every dollar you pay in healthcare related costs and health related costs goes into prevention. That's a bargain. Prevention is the best buy. And I'm also proud to say that Ramona was a leader, even as we look on the end in 2019. She was a leader as our accreditation coordinator, where the Cuyahoga County Board of Health attained national accreditation status because of Ramona's leadership and her expert work as a planner and a tactician. And so I thank you for that, Ramona, as we have. And I think I feel very good about our future as an agency with the leadership and the strong capacity we have and the commitment to try to assure that those that are often invisible and ignored are at the forefront, are the North Star of what public health is about here in Cuyahoga County. So with that, we'd like to take a moment to provide you some time to ask questions. I wanted to pause and thank Heather, because in these long press conferences, she works triple time. So we thank her for her work in assuring that everyone understands the information we're communicating and can participate. So with that, I'd like to open the floor for questions.
You guys did a great job laying out kind of the long-term contextual issues with the minority community. And, the numbers I know, they look fairly consistent with the number of cases versus the percentage of population. And I know you also talked about maybe an underreporting, and maybe this is for Ramona, but specifically, does COVID-19 affect the minority? I kind of know how, but numbers-wise, does it affect the minority community harder than the other communities?
So I'll start off, but as Ramona and Dr. Gullett think about their supporting piece, I think it's important to recognize that we talk about the disproportionate burden of chronic illness and infant mortality and rates of lead poisoning and challenges with late-stage cancer diagnosis that results in higher rates of mortality in the African American community here and in many places around the country. Those compounding disadvantages mean that they may be disproportionately affected by severe illness and ultimately fatalities associated with infectious disease. So they are at risk they're at a higher risk because of those challenges that they face that are compounded by poverty. And so those pieces are important to understand as sort of a context for this discussion. With that, I'll see if Dr. Gulla could add a bit more.
Right, so the chronic disease part is really important because we see differences or disparities in chronic disease among race and ethnicity in our community and communities across the nation pre-existing COVID-19, but we also see other issues. For example, density in a home. So when you think about emerging infectious diseases like COVID-19, new diseases where our immune systems haven't seen them, we know that transmission is higher and more people get sicker among household contacts. So if you live in a footprint of a home that has small square footage and a lot of people living in the home, it's a lot harder to isolate. So housing is really important when you think about COVID-19. And so we have to think about that for our families who may not have stable housing or who may live in smaller dwellings for large families. That's one piece of it. But you also have to think about people's access to things that help them stay healthy before they come into this. Your immune system is only as able to respond as healthy as it is to start with, right? And so if you have these underlying conditions, that's part of it, but it's also related to access to healthy foods, fresh water, and things like that. So it's not just about chronic conditions, it's also about the environmental context in which people live, which is affected by these inequities, these systems and structures that have created these conditions that set people up to have a higher rate of transmission. And those are preventable, they're avoidable, they're unjust, and they're the things we need to continue to fight for as a community through COVID and long after that.
Right, but so far the numbers are consistent though, right? But that might be an underreporting, is that fair to say?
It is. We have not.
It was like 33%, I think, of cases and 30% of the population. So that was-
39%, and again, ethnicity data I did not present to you because it was just not complete enough for me to feel comfortable giving you an accurate picture, but for race it was 39% people identify as Black or African American, and then 30% of our current census understanding of what the demographics are here in the county. But I will again remind you that that is simply the people who have access testing. That is not a broad-based testing accessibility to everyone in our community.
Do you believe the African American number is underreported based on just the testing?
So the question is, do I believe the African American number is underreported based on testing? I feel that a lot of people in our community who need testing haven't accessed it, and that includes people across lots of different races and ethnicities. But I am really concerned about people who don't have access to transportation and who don't have access to primary care providers who are able to order the test. I'm a community health center physician in this community, and I know that my patients don't have access to testing because we can't do it through our office, and unless they're sick enough to be in the hospital, we really don't have a way to get them tested. So I'm giving you an example from my own practice. So I definitely feel that it's underrepresented across multiple groups in our community, not just our communities of color, but other people who may be living in poverty or who may not have access to the testing we currently have available.
Do you believe we may ever get an accurate picture of what COVID-19 looks like in the Cuyahoga County community?
So the follow-up question is, do I think we'll ever have an accurate picture of what COVID-19 looks like in the Cuyahoga County community? And if I have anything to do with it, yes, we will. But again, as I've said in prior press conferences, we here are determined to try to get broader testing. We know our hospital partners are trying to ramp up their accessibility of testing, the number that they can run. And we're in conversation with multiple hospitals about how to do more testing. So we are determined to get a much better picture for everyone in our community of what COVID-19 looks like. But again, I don't exactly know how that's going to happen, but I can tell you we are pursuing every avenue possible to make sure we get there.
I'm curious, I don't know if this is related or totally unrelated, but the numbers show that there's 10 times as many deaths in the suburbs as there are in the city of Cleveland. Do you have any insight why your jurisdiction seems to be getting, way more deaths than the metropolitan center?
So the question is, why are there more deaths in the suburban areas than in the metropolitan center? So we only have, and I don't want this to sound, this is 20 deaths too many We didn't want anyone in our community to lose their life from this. So 20 deaths is 20 too many, but it's 20 deaths with 1,000+ cases. And so know that most of those cases are people whose addresses are outside the city of Cleveland, as far as the actual number. So when you look at the number of deaths and the number of cases, we have more cases in our jurisdiction than many other places across the state. Again, testing is an issue, so we actually don't know whether it's a matter of testing. But with regard to deaths, we do know we have more cases, so we're expected to have more deaths when you have more cases. The other thing to understand is that when people are in long-term care, the address that's attributed to them is the address of the facility where they're currently residing, and that's not necessarily where they were living before they were sick. And so sometimes, too, that's also an issue that we see. So a lot of the long-term care facilities are in our jurisdiction. So if we have deaths that are associated with long-term care or with group homes or things like that, those are going to be attributed to the place where that person is currently. So there are always some caveats to understanding the death jurisdictions, but we're trying to help people understand that as much as we can. I don't think it means that there's any issue we need to worry about with regard to deaths in CCBH jurisdiction versus Cleveland. I mean, I think we're trying to make sure everyone gets the level of care they need in the moment. So that's something we're all really committed to.
Based on the case data, it's a similar reflection. People tested positive versus the community. Is that a similar correlation when you look at deaths? Or has one race been more heavily represented in the death?
The question is around race data with regard to deaths. So the reason I didn't present you race data or ethnicity data with regard to deaths is that it also remains incomplete. I didn't feel that it was an accurate representation because there was actually quite a bit of race and ethnicity data missing on the current deaths. And the reason for that is that when we get reported data into the Ohio Disease Reporting System, ODRS, sometimes we find out about a death the same day we find out about their infection. So in some cases, someone's been reported to us and we've followed them over time and they die after a week or two of having the infection. But in many of the more recent deaths, the infection was reported to us at the same time the death was reported, and it's been hard for us to get information about that. So the information we got in ODRS didn't actually have race or ethnicity associated with it. It said this was a positive case, and this is where the person lives, and they died today. And so then we have to go back and reach the family, express our condolences, talk to them about potential contacts, and also try to get information about the individual who is deceased. And so we're still in the process of doing that for a number of the more recent deaths. And so that's why we're missing some of those data. The data I do have are not representative of the overall case race data. So as soon as I have a more complete picture, our team here, we will present that to you.
And the demographic breakdown of the cases, that is City of Cleveland plus you guys, and that's home addresses, right? Not
Correct.
people who came from perhaps out of Cuyahoga County for treatment.
Right, so the question is, the case data that I presented was City of Cleveland and Cuyahoga County, and it represents where they live, not necessarily representative of people who came here for care. That is correct. So I broke down the data today, the CCBH jurisdiction data. I put in the context slides, and then everything after the context slide was the full county, City of Cleveland plus Cuyahoga. And additionally, people who come here for care, we may get, the death may be reported to us, but we always notify the jurisdiction in which that person lives, and then that is reported out in their jurisdiction. So they may have died in a Cuyahoga County hospital, but that's not reflected in our data because they live in another county, and that county would report that out.
One more question, please.
I saw the ventilator data, so we're 35%, not that we should remain any less vigilant, but that number decreased by 20% of capacity. So is that the result of getting more ventilators into the community? And also, is that something that's extremely encouraging? I know ventilators have been kind of a buzzword as far as one of the things we're going to be, especially in this situation.
So the question, the first part of the question was around the ventilator data. Is that an encouraging thing as far as understanding that maybe it went down a little bit? And then is it a result actually of more ventilators, so the denominator of ventilators actually went up? So the first part of the question is, and remember I told you 2 weeks ago it was where it is today. And we had a bump and then it went back down. And so I actually didn't write down the actual denominator of ventilators. I can do that and I can look that up. Off the top of my head, I don't think it was a massive increase in the number of ventilators available. I think our hospitals worked really hard to pool together their resources around how many ventilators we have for the whole community. I know in places like New York and other hard-hit areas, ventilators were sent from other states to those places. I don't think that necessarily happened here, but I can look at the actual numbers just to be sure. I think this is a matter of people moving in and out of the intensive care unit and on and off ventilators. So that's important to know. In some cases, people have been moved to hospice. And so in that case, they wouldn't be on a ventilator. In some cases, people already had a do not resuscitate order. And so, they may have been one of the deaths that we report, but they never did use a ventilator. So, I think what this says is that we have a lot of medical capacity in this community. We're a remarkable community for providing high-level care, and there's no better community to get sick in than Greater Cleveland. But we still need to be vigilant. We still need people to stay home. We still need people to worship virtually, because it will not take much to swing over that dotted line and reach our 100% utilization if we had a lot of people become ill, and 1 to 2 weeks from now we see the surge from the holiday weekend. So it's encouraging, but we remain vigilant, and we know that we can always reach capacity if we don't keep up the hard work on the public health interventions.
Thank you, Dr. Gullett. Thank you, Ramona. Thank you, County Executive Budish. I'll wrap up and provide you some context for next week that I think is important. So as we think through this, please stop over this weekend and reflect on what's working here and what's working well in Ohio, because there's a lot that's working well here. There's a lot. The social distancing, physical distancing guidance that were put in place by Governor DeWine and Dr. Acton have made a big difference. The essential service discussions around trying to get folks to work remotely or to suspend business, to reduce those interactions of staff, have all worked together. The preventing gatherings and the guidance around preventing large gatherings also reduced the likelihood of spread. The changes around the election helped reduce the opportunity for spread. The contact tracing, the identification of cases, the quarantining, the isolation, all those efforts getting folks who may be at risk at home and off the street, and then we're providing guidance around when they need to seek care and only when they need to seek care. That also helps. The telehealth work that's gone on to remotely provide healthcare information through the hospital systems to those at risk also was an important part. The work that Executive Budish's team did through the Emergency Operations Center to distribute much-needed personal protective equipment to assure that people are not exposed in the work environments, from EMS to healthcare and a range of other locations. All these things, the confluence of all these things have been effective. So our playbook, the Ohio playbook is working, the Cuyahoga County playbook is working, and there are many to thank, because there's a wraparound social service system that's taking care of those folks that are living on the edges that you heard about today. So with that, I wanted to let folks know that we want them to have a safe and healthy weekend. And beginning next week, we'll be moving to a new schedule for our press briefings. We will meet with you 2 times a week rather than 3. Updates will be provided on Tuesday and Friday mornings at 8:45. So our new schedule will go to Tuesdays and Fridays at 8:45, and Friday will be our data briefing as usual, so that'll remain the same. And we wish you all a very relaxing and peaceful weekend. Thank you.